Hello friends, welcome back in the channel of Clinical Care Insight. In today's podcast, we are going to discuss about one modern emerging branch of pharmacology, or more specifically we can say it's a branch of medicine. And the name of this branch is called pharmacogenomics. Okay, the branch is called as pharmacogenomics. In this podcast, we are going to understand what is actually mean by the pharmacogenomics and how it can improve the patient's life. Okay, how we can improve the ways of treatment by using this pharmacogenomics. Fine. I hope you all are all right. Fine. Okay. So let's begin understanding about the pharmacogenomics. First of all, pharmacogenomics is a branch of pharmacology which deals with how our genome respond to the drugs. You know that whenever we become sick, we take some medication. Most of the time it is prescribed by the physician, isn't it? So we take the medicines, and this medicine, when it goes inside our body, it shows some reactions. It's undergo certain metabolic changes, and you can say exhibit their property. Okay, exhibit their expression. Fine. So this is the way by which we take in the medicine, and it goes inside our body. Okay, and it's metabolized, and it's exhibit their expression, their function, and thereby we become, you can say, healthy. We become healthy. Fine. This is a you can say a ways of taking the drugs. Now you know that not everyone is like taking the same drug and responding in the same way. Some take the drugs and they have a certain undesirable, you can say, sign and symptom, and that is called as the adverse effect of drug. And some takes the medication, they have the desired effect of medication. Okay, desired effect of medicines. So why this happen? Why one category of persons they have you can say appropriate kind of you can say drug manifestation, a drug outcome, drug result, and one category of persons they have the, you can say, adverse kind of effect, adverse kind of expression. Why? Yeah, the reason is, and you can say, you know that we all are genetically, you can say, diverse. Fine. We possess certain gene which we inherited from our parents, our ancestor, and this gene is not, you can say, same in all the human species or human population. These genes shows variation, and due to this variation, we all are not fit into this one category of drug. We shows the, you can say, different diversion. Okay, different we can say you shows the different variations. Fine, understood. Now so it means we have to specify the drugs for one particular category of people, isn't it, so that we can provide the optimum you can say the optimum outcome of the drugs, isn't it? And this providing this specific category of drug to the specific person, it is called as the personalized medicine. It's called as the personalized medicine. And nowadays it is, you can say, emerging. It's a emerging. So in this today's podcast, we are discussing about why you can say pharmacogenomics is important to provide the optimum care to the patient. And second thing is, we are also going to address that what are the challenges. Okay, since it is known for us that there is something called pharmacogenomics, there is you can say correlation between the person, their person genetic machinery, and the drug they are taking. Then why we are not using it widely? Why we are not using it clinically? Okay. So what's the reason behind this? So let's begin today's podcast by understanding first the meaning of pharmacogenomics. Then, as I said, that pharmacogenomics is a, you can say, a branch of medicine, okay, which shows that how we respond, our genetic makeup respond towards the administered medicine, Now, it comes into the picture, it comes into the scene just because when a person is taking some drugs, they don't have the desirable effect of drug. This shows the adverse effect of drug. That's also called as the side effect of the drug, isn't it? And these side effects, they are not, you can say, something which we encounter, which we, you can say, not pay attention. This is life-threatening. This can be a life-threatening situation. Okay, so I'm taking the one example. The example is for codeine. Okay, codeine is the one, you can say, opioid analgesic. Codeine is the one opioid analgesic, and it's a prodrug. Prodrug means those drugs which we take, and then inside it become activated by our certain enzymes. Fine. So these codeine, when once take this codeine, okay, it changes into the morphine. A potent, you can say, analgesic, opioid analgesic, and this is done through one enzyme, and that enzyme is called as the P2D6. Okay, and this enzyme is present in the liver. And this enzyme, it's act on the codeine and it changes into the morphine. Now, this enzyme is, since you know that enzymes, most of the enzymes are protein, isn't it? Most of the enzymes are the protein, but certain enzymes, they are not a protein, but most of our body enzymes is the proteins. And you know that proteins are encoded by genes. Yeah, proteins are encoded by the genes, and you know that not in everyone have the same pattern of genetic makeup. Okay, or we can say the same genome. Genome is the entire set of genetic material present in one human. It is called as the genome. So not everyone have the same genome. It means not everyone have the same enzyme. Okay, and it's one clinical finding. It shows that this CYP2D6, okay, CYP2D6 enzymes have at least 100 variation. How much? 100 variation. It means if one is taking these drugs, they have the accelerated metabolism of this drug, and someone who is taking this drug, they have the poor metabolism. So the person who have the accelerated metabolism of this codeine, okay, they source the opioid toxicity. Now, what are the opioid toxicity? Opioid toxicities are a group of signs and symptoms which is occurring in a patient who are, you can say, sensitive towards this opioid, and who have the variant form of this CYP2D6 enzyme. Okay, and person is showing, you can say, certain features like they have the seizures. Fine, they have problem in the vision. Okay, there is, you can say, respiratory depression. Apart from that, there is a cardiac abnormalities. So these are some sort of opioid toxicity. Okay, and sometimes it become lethal. It can, you can say, take away the life of a patient. And another category of persons, they have a poor metabolism of this, you can say, drug that's called the codeine by this enzyme CYP2D6. It means they have a less effect on the pain, because we are taking the codeine for relieving from the moderate to the severe pain. So if a person have the another variant category of this enzyme, okay, so there is a poor metabolism of the codeine, okay, and it means they have the less, you can say, pain effect. They have the less, you can say, drug effect on the pain. Fine. So this is one example. Apart from that, there are certain drugs. Okay, there are certain notable drugs which is, you can say, already, you can say, depicted by certain organization. And I just remember the one organization which is actively, you can say, participating in this pharmacogenomics, and this department is called as the US National Institute of Health. US National Institute of the Health is the one body which you can say emphasizes the importance of the pharmacogenomics in giving the care to the patient. Okay, and it's shows certain drugs which have the higher you can say rate for causing the discomfort in reference of the genetics and administered drug. And some notable example I'm just dictating. The one is called allopurinol. This allopurinol is used in the kidney as well as in the gout arthritis, to managing the kidney diseases as well as the gout arthritis. Apart from that, there are another drug called as the carbamazepine. Carbamazepine is an anticonvulsant as well as it's an anti-epileptic drug. It is used in the case of epilepsy. Okay, now another category of drug we already discussed is the codeine, which is actually a opioid analgesic. Apart from that, there is something called chlorpridazole. Chlorpridazole is a you can say it's an anticoagulant. It's an anticoagulant. Apart from that, there's a one blood cholesterol lowering agent called as simvastatin. Okay, simvastatin. It's a blood cholesterol lowering agent. Apart from that, there is one you can say most notable example. Probably you are aware about that. That is called warfarin. Warfarin is an anticoagulant. Okay, and there is a problem related with both the warfarin sensitivity as well as the warfarin resistant. Got it? No problem. Now, once we understood that, fine, the person genetic makeup can determine the effect of drug. Now, then we have to understand why it is not used clinically. Why it is not used clinically. Now, for implementation of these drugs in the clinical utility, it means pharmacogenomics utility in the clinical field have some sort of challenges. The first challenge is that we have to screen the genetic material for entire population. First, we have to understand that which category of a patient gene shows the variation. So first we have to list down all the genetic variation, and that's really you can say a hard process. It's really a challenging process. That's the first challenge. Second thing is about their cost. Okay, you know that nowadays, due to the advancement in the you can say genetics, people easily undergo the genetic screening. They easily undergo genetic screening, but yet it is, you can say, cost effective. It's yet cost effective. Okay, no problem. Now, apart from that, there are another challenges, and that challenges is about to educating the physician. Not all the physician is aware about the you can say the genetic variation in relation to the pharmacogenomics. Okay, in relation to the drug use, not all physicians are administered. So we have to educate the patient, we have to educate the physician. Okay, we have to advance or improve the genetic screening, isn't it? As well as we have to make you can say a proper set of database. Okay, we have to prepare or store a proper set of database. Fine, no problem. And apart from that, there are certain organization which is actually doing a good job. Okay, they are basically categorizing the drugs. They are marking the drugs. And one of the category is the US Food and Drug Administration. They are labeling certain drugs which have you can say the adverse effect on the you can say children's, like below the 12-year children's are you can say very you can say prone towards administration of codeine. Okay, so just the label on the drug you can say the drug box that this is not used for the less than 12-year patients. Apart from that, those person who are undergone the tonsillectomy, okay, they have the higher chances to develop the adverse effect of the codeine. Apart from that, in the pregnancy, and we have to restrict certain drugs. Okay, so now it's also explained why certain drugs are not used during the pregnancy. Okay, just because of the pharmacogenomics. Doctor don't want to you can say take the risks, so generally they discarded those category of the drugs, and instead of those drugs they are using the another set of drugs that is have the less side effect. fine. So for summarizing today's podcast, basically we understood that our genetic makeup can affect the drugs. We all not have the same genetic material. It means we all not shows the same, you can say, effect toward the same medications. We have the variation, okay? Variation if we're talking about the effect of drug, okay? And there are, you can say, challenges as well as the advancement in the pharmacogenomics, and there are certain bodies which are doing the really necessary a good job, okay? The one is the US health US, you can say, the health organization. Apart from that, the FDA, US Food and Drug Administrations. So I hope you understood today's podcast. If you have any, you can say, if you have any doubt, you can comment down. We will love to answer your queries. So thank you with having me. Bye. Have a nice day.